Hi, I'm Dr. Becky Davis, and I'm one of the neuropsychologists here at the Billings Clinic. I'm going to be putting out some videos over the next few days about how we might work effectively with anxiety during this time of the coronavirus. Now, this is not meant to be therapy or a replacement for therapy, but we all can develop additional tools to be more effective in managing anxiety. Now, many of us are experiencing symptoms of anxiety, maybe some of the worst we've ever had over these last several weeks. And some of the typical symptoms of anxiety include things like tightness and tension, having trouble focusing, excessive worry and anxiety, feeling of anxiety, having trouble sleeping, maybe having headaches, having more pain, irritability, having that sense of just wanting to get away, to run, to get away. Those are all really normal symptoms, especially during times like this. So, on the other hand, there are people who are going through this and feel really energized and find a sense of purpose. And for those, they actually, in some way, enjoy being able to be helpful and get through this. So my suggestion is not to judge. If you're in either of those camps, not to judge the other. We all have come to this situation, this crisis, with whatever was happening in our life before we got here. And for some people, that was a good place, and for others, it was an extraordinarily difficult place, to whatever degree. And so we can't judge how somebody else might respond. And thank goodness there are people who get energized. And for those of us who maybe don't fall in that camp, thank goodness there are ways that we can get through it better. So, also those of you who have an underlying anxiety or depression disorder condition, my heart goes out to you because this has to be an extraordinarily difficult time for you all. And so here's a couple of ideas. One is, if you haven't already, reach out to your therapist. There are plenty of people in our community who are providing services via phone or video. If you don't have access to that, you might see if your company has access to EAP services, and that might be an idea. There are lots of online resources, and so you might just Google online options for therapy. That might also be an option for you. So another idea is to sit down sometime when you're feeling a little less anxious and develop a written coping plan. This would be something that you would add to as the days go by. The place to start is with what's worked for you in the past. So when you've been through really stressful times with lots of anxiety, what are some of the things that have been helpful? So for example, if one of those things was going to the gym, then obviously you're going to have to tweak that because that's not available right now. So you might look at what it was about going to the gym that was helpful for you. Was it the physical activity and the sweating and just being able to be that active? If so, is there a way to tweak that and do that at home? And there are lots of online information about how to do that even without equipment. Was it the social activity? Well, what you might do is to see if your buddies that you normally saw at the gym could have maybe even standard times to get together via video or phone at the same times you might have been at the gym together. Was it the structure of going to the gym, that routine that really helped you? So maybe there's some other routines that you can add. So develop and start to develop a written coping plan, because when you're more anxious, when we're the most anxious, we are the least creative in problem solving. And so if we can come up with strategies when we're a little less anxious, it can help us when we're more anxious. So hopefully these videos going forward, they're not intended for therapy, they're intended for all of us because we all can benefit from a better toolbox. So none of us asked to be here in this time of coronavirus, but it is here. And so our best path is to find a way to find courage and compassion and empathy for others, so that we can all get through this the best that we can. I had a meditation teacher who had an affirmation that I've kind of tweaked, and so I'm going to read it so I can make sure I get it right. And it's this. This is something that you might say to yourself, and there's something like this that I have been saying to myself. May I find the courage and compassion to face this as best I can. May I find the courage and compassion to face this as best I can. So in the coming days, I plan to have some short videos about techniques, which I hope will be helpful. So blessings to you.